We are not even in double digit. Sunday effect. All right, let's start. So yesterday in the first part, we talked about all the various types of cells, right? So all the way from what was the squamous cell, that is flat. Then there was cuboidal. They were cube-like. And then finally, we talked about the columnar. So if it is to be identified, then we said that we'll identify them with the help of their nucleus. In the first case, it is quite flat. In the second case, it is round. And in the third case, which is basal, right? Basal. It could be oval or it could be round. It could be round, right? So when there were one layer, so we were calling it simple squamous, simple columnar, simple cuboidal. And then when there were multiple layers, so we call them stratified. Stratified means anything which is arranged in layers. And the name of the layer, which is the topmost layer, accordingly the name is given. So it can be stratified epithelial, stratified columnar, or stratified cuboidal. Right? So that's how everything was moving yesterday. And then lastly we talked about the transitional, especially in the case of, say, urinary bladder, right? That is when it is stretched, so it was squamous, and when it is relaxed, so it was cuboidal. Right? Today we'll be talking about glands. There are various types of glands. So even when you sweat, that is also a type of gland. And the secretion of mouth, that is also a type of gland. The basic purpose of gland is to keep the area lubricated. This is one of the very important physiological function also. And it has got so many pathological associations also. Right? All right, it's time we start with our today's topic, and that is glands. So when we say that a normal epithelium, right? So normal epithelium, that is like a single cell, and it is carrying its normal function. Right? It will be carrying its normal function. But when it has got a special function, and that is the secretory function, that is when the glands come into picture. So this is a very proper definition. Epithelium with secretory function. What type of epithelium? Well, that is, it will come as we progress. So there would be one, the exocrine. Exo means external. It means the secretion will be outside the body. So connection with surface epithelium. Say for example, skin. So secretion will be into ducts, and these will be the enzymes. Right? So here the secretions will be outside. There would be some areas when it will be called as endocrine functions, right? Endocrine glands. Sounds quite familiar. So there is no connection with the surface epithelium, right? The secretion is into blood vessels, and that's why we call them hormones. So when we say the adrenal cortex, right? Adrenal cortex. So adrenal cortex is exocrine as well as endocrine, right? Because there would be some secretions which are into the blood. There would be some secretions which are into the lumen. So whenever the secretions, they are into duct, they are called as enzymes. And when the secretions, they are going directly into the blood, we call them hormones, right? So the basic difference. You must be knowing, say for example, in past we talked about our gut health, right? Gut health. Why probiotics? And why probiotics, they are so important? Because in our gut, in our digestive system, it is also called as the second brain. And the most interesting part is that there are bacteria, and these are the good bacteria. There is a team of good bacteria, and they produce so many things, but one of the things which is called as the serotonin, right? Serotonin or the happy hormone. Now, this serotonin is manufactured in the gut, but via vagus, its effect will be on the entire body. Its effect is onto the brain. So that's a very important part. This criteria or this concept, that is when you give some heavy dose of antibiotics to some patient. So with that antibiotic, if you are not taking care of the bacteria, so then what really happens is that those bacteria, they are slaughtered, because antibiotic, they won't be understanding that who is good and who is bad. They will be slaughtering every bacteria. So there would be decreased manufacturing of serotonin, decreased manufacturing of B12. So if those things, they are not artificially replenished, so then person will be into sad mood. We find that he is pretty disturbed, pretty depressed. So that is the effect of antibiotics, right? So, and for a healthy person, very basic thing, probiotics. Say not much, you eat pomegranate, anar, right? So that anar ke dane, in there, that anar ka dana, right? There is that beej, right? Chew that also, because this is something which is like a heaven for those good bacteria. It won't be digested, but it will be helping a lot for the development of good bacteria. Similarly, your beetroot, right? All those things, they are very important. Something which is available so cheap, but it is very good for your body. And when you are studying in medical, right? As many of the emails when it is received, they say that there is so much of stress. I have even replied that, mere bhai, stress will be for the whole life. Ek nahi to dusra, koi na koi stress will always be remaining there. So the thing is how you are managing it. And for that, it is very much necessary that your body should be healthy, and at the same time, your brain should be healthy. This is what you are learning right now, right? What you are learning now, medicine. It is not a sprint, it is a marathon. So keep both the things into its top condition. So for brain, say these gut health, that is very crucial. So for example, if you eat watermelon, to chew the seeds also, don't throw away the seeds. Those seeds, they are absolutely awesome for these happy bacteria. They would love it. So we understood exocrine and endocrine. Exocrine means secretions will be outside. That means it will be going via the ducts. And in endocrine, secretions will be going directly into the blood. That is the hormone. So here it is, how we differentiate. This is exocrine and this is endocrine. Now look at it. Everything starts with this epithelium, right? And then there is basal lamina, which we were calling as base, right? Or the basal layer. And then there is rest of the connective tissue. So these are the nuclei and they are at the basal side. And then there will be proliferation. There will be multiplication of cells and they are growing down, right? Into the adjacent connective tissue. This is the connective tissue, right? So this one is the connective tissue. This is connective tissue, this part. Right? So that's the connective tissue. It keeps on developing, right? Proliferation, that is multiplication of those cells, it keeps on happening. And finally, they would differentiate, but then there would be the formation of a duct. This is the duct. This duct is opening outside. So when it comes to skin, when it comes to sebaceous gland, so it will be secreting the sweat, right? So they will be opening this outside. And thus it has got two portions. One portion, the duct which will just carry the secretion. It is this secretory portion. It is this secretory portion which will secrete that particular secretion, which is with respect to that particular gland. When it comes to, say, endocrine, see the proliferation. Again, this proliferation is from epithelial cells only. It grows, and then there is disappearance of duct cells. They go into the state of what's called as the apoptosis. So they degenerate. So thus it is disconnected. And now this group, that particular group, that would be the secretory portion, and it will be in association with the capillaries, so that whatever the secretions they make, they are drained directly into the blood. So that is how the development of exocrine and the endocrine gland occurs. Right? This stage, this is the important stage. Okay. Now, on top of it, endocrine, we understand, right, that they will be putting it into the blood. So endocrine products or the hormones, right, that is what we call it. They travel in blood to distant targets, correct? They will be traveling all the way to distant targets. But there are some other type of, they are called as the paracrine. Para means near, right? Para means near. So this is the paracrine products, hormones. They travel in interstitial space to very close targets. As we'll go into we'll learn endocrine system. So at that point, these things will be still more clear. But the point to remember is that when it comes to paracrine, it means the target is not far. In endocrine, yes, serotonin, say for example, it is secreted in gut and affecting all the way to the brain, right? So then, because it is traveling via blood. So let's dive deep onto the exocrine. Exocrine means, do remember that it will be secreting the secretions externally, right? So this is the external cells. Starting with first, unicellular, and see the goblet cells. Yesterday we talked about it, right? They will be looking like a blank space, right? Here are the blank spaces, goblet cells. See the goblet cells, right? So this is a zoomed version, right? If you zoom it, this is how they will look like. But let's see what they are. So goblet cells, mechanism of secretion is exocytosis. Exocytosis. What it is secreting? It is secreting mucin, right? It is secreting mucin. Appearance is pale. That's what we saw, right? Appearance is pale, as if it is a blank space, as they do not take H&E stain. That's the most common stain which is used to say stain all the slides. So when we were watching that, okay, these are the columnar stratified, these are the simple columnar epithelium, and in between we are watching these blank spaces, because all these cells, they picked up the H&E stain very well, while goblet cells, they didn't pick up. So that's why they were not. For that, a very special stain is needed. Multicellular, they are like ducts. Now over here, we talked about one mechanism of secretion, exocytosis. So what exocytosis is? Here it is. This is the first stage. That's our cell membrane, right? This is our cell membrane. So obviously this will be like our intracellular, and this one would be the extracellular environment, right? In and out, and that's the cell membrane. In the cell membrane, right? Here is all these secretions, right? They are into the form of a capsule, or they are in the form of a pouch, which is called as the vesicle, right? Or the vesicle. So this vesicle, it approaches towards the surface. At surface, their membranes, they meet and then they disintegrate. So thus, the contents, they are released into the extracellular environment. Why this mechanism? So that this intracellular environment is not exposed to extracellular environment. Right? So that's why they fuse and then they go out. So that is how, say, exocytosis would occur. Now, let's say some bacteria comes, right? Or some pathogen comes. So yes, the cell wall, they would really take it, they will shrink, they will take this substance inside, and then all the processes will start and it will lead to phagocytosis. So this is what is called as the endocytosis, and this is called as exocytosis. Exocytosis is a process by which the cellular substances, they go out. Endocytosis, that is from outside, things are taken inside. Now there are several classifications. There are several ways by which we can classify the glands. We start with the simplest explanation. And this simplest explanation is, it is based on the type of secretion. Later on, we'll see, depending upon the branches, depending upon the size, all we'll see. But let's start with the first one, serous, mucus, and mixed. If you understand only this classification, still you'll be having a very clear concept about how the glands they are situated. When it comes to serous, that serous is like water. Right? Remember, serous is like water. It is a watery secretion. So serous acini, which are majority, most of them, and mucus acini. See, the way it is that in every male there is testosterone and estrogen, and in every female there is estrogen and testosterone. But the only thing is there is difference in the proportion. In male, testosterone is high, but estrogen level, yes, that is present, but at a very minimal level. Same vice versa for the female. Exactly the same way when we are talking about serous gland, it is not so that they will be having only serous acini. Acini means that component which is secreting. There would be some mucus acini. Similarly, when we'll see the mucus gland, most of the acini, they will be mucus, but there will be few serous acini. And when we're talking about the mixed, then the proportion is almost same. Right? So here it is the first part. Acini is the secretory part. So when we draw it like this, right? We draw it like this, so we call this thing as the duct. Ducts won't be secreting anything, they will just conduct, right? They will just take this material into the external environment. So this part, which is the secretory part, right? That part is also called as the acini. Clear? Right? So that will be called the acini. So say for example, parotid gland. Right? Parotid gland. So their secretion is watery. Right? See, the secretion is watery. Saliva is watery. Right? So this is for saliva. Pyramidal cells, you'll find that the cells, they are typically like this, pyramidal cells. Round nucleus towards the base. And secretory part is highly eosinophilic. Right? Eosinophilic, red, and lumen size is small. Now see, these are the characteristics, and it is very typical, very classical. So we saw that. So if we really want to draw this thing, right? I'll show you the real images, but let's say we don't have the image, we want to draw. So let's draw it like this. We said pyramidal cells. So obviously we'll be drawing the pyramidal cells something like this, right? We will draw it like this. Round nucleus, right, towards the base. Okay, even that. Obviously, right, we have to complete the okay. And then they'll be staining red. So I'll just write red. And lumen size is small. So this inside part, that would be lumen. That I want to. So I'll make the cells big, huge one, right? Because I want to make the lumen size small. Right? So things should really look something like this, which is having 4 characteristics. Let's see if it is really like that. See, right? Here it is. So this is parotid gland, HNE stain, and see this part, the lumen size, right? And these are the secretory vesicles, right? See the secretory vesicle. What you have to really watch is, see, just watch this part. Let's watch this part and zoom this. See, if you really pick up one, right, we are taking only one secretory vesicle, right? So thus we have got all those secretory areas, and then there would be the lumen, right? See, everything whatsoever is stained red, right? Red, or they are eosinophilic. So that is how they will be arranged. So there will be, say, one secretory portion, right? And here is the in between is the lumen, so I keep a blank space. Then there would be another, then it would be another, then it would be another. So it is like all those ducts, they will keep on joining with each other and they will become bigger and bigger duct. Correct? They will become bigger and bigger. And that final duct, this is the complete section of, and that final duct, that becomes the lumen, and it becomes the duct which will be carrying the secretion. Right? See. So several of them. So these are, but can you see that if this is the gland, then there are some other areas also which are not fitting into our description, right? Otherwise, rest, all these pinkish areas, right? These reddish areas, all eosinophilic areas, they are having all the four concepts. Right? So let's see this. We'll have several examples. So this next one is the mucus. Mucus means it will be a thick secretion. So in this, as we discussed, mucus acini, they are majority, and the serous acini, they will be less, right? Watery secretions. So that is the sublingual gland. So our saliva, as such, it is watery, right? Our saliva is as such watery, but then there is some thick secretions also. But sublingual secretion is, the quantity is less. But yes, that secretion is mucus. So when it is mucus, so here it is cuboidal or columnar cells. Remember, over there it was pyramidal cells, right? Over here, these are cuboidal or columnar cells. So when they are like that, right? These are the cuboidal. The striking difference would be the flat nucleus, because this is pushed down by mucus. In cuboidal or columnar, we always used to say that if this is the cuboidal, if this is the columnar, then what type of nucleus? There will be a round, large nucleus, right? Or this type of nucleus, basal, oval. But in this case, this is a very important feature. It is flat, because function of this particular cell is to create mucus. Now, mucus will be secreted over here, so that secretion is in such a large amount that you will find that in spite of cuboidal cells, in spite of columnar cells, the nuclei would be literally pushed down and it will be flat, because this entire thing is nothing but it is the secretion. This is the secretion which is to be released. So because that's the function of this particular type of cell. So it is this secretion which will be released. So that is the mucus. And when it comes to mucus, so that mucus will be pushing the cell down. So this is the mucus, right? It will push the cell down. Now the secretory part, this is not eosinophilic, right? It is not eosinophilic. So that's why it will be staining bluish, right? So that's why it will be staining bluish stain. And these cells, as we drew it over here, so the lumen size would be big. So now there should not be any confusion between whether it is a serous gland or the mucus gland, because these are the clear-cut, very clear differences between both. Let's see a mucus gland. First, right, all these are mucus glands. So from where we have picked it up? Yes, from the sublingual gland. Sublingual gland, because sublingual gland, in that the secretions, they are mucus. So majority will be there. So here it is. Watch the cell. How properly we feel that yes, they are pushed absolutely at the base. Right? See over here, the cell, right? The cell. And every nuclei, it is pushed at the base. Right? So So nuclei, they are at the base, nuclei at base. The lumen size, that is pretty big, right? And this cytoplasm, that cytoplasm is nothing because it has got large amount of mucus. That is what will be released into the lumen. Right? So these are the two very important and very clear differences between serous and the mucus gland. Now, from this, so many questions can appear into your exam. Right? But if you remember these keywords, yeah, just at the end, remind me, some few mails, they are coming again and again. One was regarding the notes, how to make the notes. Though we have discussed it in past, but we'll spend about 5 minutes on that for the notes. Because some emails they are coming repeatedly. It's either from the same person or from different person, but we'll sort it out today. And one more thing, that is about the BD Chaurasia. I just read the email that you have purchased BD Chaurasia older edition, and your friend is having a newer edition. So older edition, they have not explained about side determination of clavicle. That's not possible. That's not possible. Because side determination of clavicle, that is such a basic thing. I mean, those differences, the side determination, etc. Even if you pick up a 20-year-old book, still it will be there. The newer books will be having some applied anatomy. Right? They think what is called as the applied anatomy. Applied anatomy means whatever the anatomy which you are learning, how it is put into clinical practice. So in newer books, they have increased the weightage of this applied anatomy. But don't worry much. Say, there are some very standard syndromes associated with every condition. Right? So it is not necessary to know everything line by line, word by word. I'm telling you, medicine or the medical science is learned as a concept. So once your concepts are built properly, once you are very clear about that this is how the brachial plexus is formed. Yes, someone might be knowing some rare syndromes, right? It really doesn't matter, because our teachers always used to say, when you try to go for rare reasons, you are rarely right. Right? Go for the common things first. Even that thing would be the foundation of your medical practice. Think for the common things first. Bus. Right? So don't worry about it. If you are having older edition, one edition here or there, it won't make much of the difference. And yes, now to why hyperswitching from we'll just take this. Sure. Achha. So and one more thing, because you all are having access of that, say you are having e-books. So when you have got e-books, Gray's Anatomy is definitely good, right? Oh, great, nice. So if you have got the Gray's Anatomy, keep it as a reference book, right? You can keep it as a reference book, or for others, say you can keep e-book in the e-book format. So when you have got some doubt or you want to look at the pictures, let's say this is Sunday, you don't want to learn, I don't want to read. So then just flip the pages of Gray's Anatomy. Maje se just go through the images, because images are awesome. Right? So just go through the images. Now, if you have learned, let's say, I'm just giving the example, you have completed the upper limb. Now you go through the Gray's Anatomy and just watch all the images of the muscles, all the nerves, arteries, veins, and then hide with your hands or with a piece of paper all those labeled structures, right? So that description you hide, and then try to identify what is what, because that is like a real life image. So that is how you can always use the Gray's Anatomy. It is very good book, right? I mean, it is like Bhagavad Gita of anatomy, no doubt about it. But if you try to read everything via that, then the time would be very short. So some books, they are awesome. They are the reference books. Even, yes, we used to read, even in final MBBS, right? When you are learning surgery, if there is any say problem in the concept, we used to go back to Gray's Anatomy, right? Fatafat utna dekh liya, because by that time you are pretty mature enough to pick up what is needed. Bas, right? So abhi ke liye images, wonderful images, very fine images. Even that Cunningham manual, Cunningham book of dissection, right? Very good book. Step by step, all those pictures are there. So just go through it. So that is, I used to use those books like खाना खा के संडे को, मतलब आप खाना खा के बैठे हैं, you don't, your brain is not in the mood to take some heavy stuff. So at that point, these images, they help you a lot. Right? And it is, you are always at your liberty. मतलब 10 इमेज देखी ठीक है, 15 देखी ठीक है, 5 देखी ठीक है, at least you did something. Okay, so these are the two major differences. These are the major differences between serous and mucus. Very important, and even from USMLE standard. Right? These things, because it is going to come in one way or other. On to the mix. It is called as intermediate. So when this is what obvious mixed secretion, so there would be mucus as well as serous, both, right? And what type? Submandibular. Now immediately you must have noticed that it means we have got parotid, sublingual, and submandibular. Correct? Submandibular. So we have got these three types of secretory glands. Out of this is serous, this is mucus, and this one is mixed. Right? So all three glands, they are of different type. So here it is the submandibular. So how to identify this? Very typical. It is called as the demi-lunes. Again, there was one email regarding के सर ऐसी terminology भी याद रखनी पड़ती है. बिल्कुल बेटा, all the terminologies. What you are getting in these notes is, this is just the juice of the entire this topic. You just remember serous demi-lunes. Demi means adha, half. Lunes means these are like mounts. So here, mucus acini, they are capped with serous acini. What does that mean? That here it is. This is first, just draw the mucus and usko upar ek cap laga do. That is the serous, right? So this is the mucus, this is the serous, and this whole thing is called as the demi-lunes. In exam, in Viva, the moment you use these words, that you give this description, yes, it is good, but when you use this demi-lunes, you are a killer, right? Because you have given the complete concept. So that's the subtle difference. So whenever you discuss with these keywords. Always try to remember the keywords. This decreases the thickness of secretion, obviously. What's the big deal in that? Because it is, mucus is the thickest, serous is pure watery. So in this thick secretion, some water has been added. So obviously it will decrease the thickness of secretion, right? So we just put a smiley. It is so obvious. So here it is. Say mucus acinus. Now go back. Mucus acinus. Mucus acinus, they were all pyramidal cells. So yes, these are pyramidal cells. These are pyramidal cells. Right? And there was a small lumen. But on top, there is serous demi-lunes, right? These are the serous, which is like a cap, right? This is a serous acini. So they are over there. So here in this, look at it. This first one, right? This first one, right? Which is just the duct, right? It is the duct. So no secretions, right? Over here, this is a duct. So in this, there is no secretion. So that's why the cellular formation, it is normal cells. Over here, this is the mucinus, right? Mucus, and on top of it, it is serous. So it is a mixed one. When if it is of only serous type, serous acinus, so you see, the nuclei, it is pushed at the base, and the lumen is so wide, right? In case of mucus, it was a small lumen. So that's what is called as That's what is called as the serous demilunes. That means these are the mucous acini, right? This is mucous acini, and on top of it, the mucous acini, and on top of it, there is a cap of serous, and this whole thing is called as the serous demilunes. Now, here it is, myoepithelial cells. Now, someone asked a very interesting question. Why hypersweating from palms and sole occurs even when in relaxed state? Right? You said that please address this question at the end. Why? And at the end, we discuss it now. You must have noticed the secretion from palm, right, or secretion from sole. Right? When someone is frightened, किसी को डर लगा, right? When someone is in stress, right? Someone is nervous. So what is this? In all those states, can we say that it is the sympathetic stimulation? Correct. Because sympathetic is for stress. Correct. Sympathetic is for stress. So whether a person is nervous or is facing some fear or very happy, whatsoever, but it is this sympathetic system which is in. The things goes over here, the myoepithelial cells. Myo means muscles. Epithelium means these are the muscular cells which are present over there. Now, these are not under our control. They are under the control of sympathetic system. So that is when these myoepithelial cells, when they contract, so when they will contract, so this serous portion, watery secretion, right? This watery secretion that would be squeezed, and it will be going into the duct and leading to that sweating. Otherwise, normal secretion, mucous acini, that is constantly secreting, right? Constantly secreting. I mean, it's a bit weird, but right? So that what comes out, that is all mucinous. If you really rub your hand or palm, so that jo nikal ka hai mail, right? That is all mucinous. But when person is sweating, right? Person is afraid, right? So all those, that is because of the compression. Those myoepithelial cells, myo muscles, they squeeze, and they squeeze this serous fluid, and then that becomes like a sweat. It becomes sweat. It is more watery. So myoepithelial cells. So what they do, they wrap alveoli and intercalated ducts. Right? You'll find those things even at the alveoli and the intercalated duct. They squeeze the secretion and then they pour it into the duct. Right? So here, these are all intercalated ducts. All these ducts, they are connected, and finally they will be going. Right? All these ducts are connected. This duct connection that is similar at every level. Right? So all those ducts, they keep on joining like a river, and finally the main duct is formed. So here it is, the trachea, right, where it is needed. See, this is how it looks like. The look itself will say immediately that yes, this is a semidunes, right? Watch this part. So here it is. Correct? This portion, and on top of it, this is a cap. So this is the mucinous, and this one is serous. Correct? Watch it. Now you will be able to, and see, there is so much of variation. Right here, sometimes the cap might be bigger. Right? See all those variations. These are mixed. This is mixed. Here it is the demilune. Right? So these are the serous cells, and see over here, right, they are the demilunes. So if this slide comes into exam, right, in the histology exam, if this comes, so then it would be like, if the arrow is over here, then this is a classical appearance. In exam, you will always be asked a classical appearance. Right? over here like this. Otherwise, watch for this, or watch for this. Just over here, such a small lumen, right? Small lumen, immediately it will be serous, correct? Because those mucus, they will be having big lumen, right? The lumen size will be bigger. The lumen sizes will be bigger. And when it is mixed, remember it is the cap. So mucus cells, this is the mucus acini, pyramidal cells. Right, pyramidal cells. And the lumen is big. That's a salivary duct, so that's a common duct. And these are the serous cells in which the nuclei, they are pushed towards the base. Right? Serous demilunes on mixed acinus, and that's how this is formed. So here it is. Next is type of glands which are based on mode of secretion. Yesterday we talked about this mode of secretion. Right? So they are called as the merocrine, apocrine, or the holocrine. Right? Very easy. So just where exactly those are. Right? That's the facial now, and here is the parotid gland. Right? Just over here, the parotid gland, that is the first gland. Then the submandibular gland, and inside is the sublingual, right, which is underneath the tongue, that is sublingual. Under the mandible, it is submandibular, and parotid, which is just to this temporal area. So we start with merocrine. Right? Exocytosis. Merocrine. They are also called as the ecrine glands. Exocytosis. So they'll be releasing outside. Gland remains intact, but it will just keep on releasing the substance. That's like a sweat gland. So over here, it won't get destroyed. Actually, the secretions, they will be coming out from the cell and they'll be going into the lumen, the sweat cell. Right? So the sweat glands, they are basically merocrine glands. That means the gland itself will not be affected. No part of the gland will be destroyed. Right? And they can keep on secreting. So the best example, sweat gland. And this is how the sweat keeps on coming up. The next one is the apocrine glands. Apo is apex. So apical part. So this apical part, this is the cell. So this apical part, it is pinched off and it is detached. Right? So cell is destroyed. Cell is broken. Mammary gland, atypical sweat glands. Atypical sweat glands. Now, atypical sweat glands is, say for example, sweat glands of axilla and the pubis. There is a typical odor or the smell. It is called as the odor in every human body. It smells. That's why people use all those deodorants, etc. Right? So what they really do, because it is the part of the cell itself is pinched off, it is broken and it is released into the lumen. That's why it has got a typical odor, typical smell. Right? Mammary gland, they are also functioning exactly in the same way. So here part of the cell is broken. Right? So here it is the graphical representation in which the apical portion is pinched off. That's the key word. Apical portion is pinched off and portion of the cell is released into the system, into the secretion, and that thing is called as the apocrine. Right? Apocrine. Apo means apex. Right? You can remember apocrine means apex. And third is holocrine. Holo means whole. Whole of the cell is disintegrated. Whole cell dies. New layers, they keep on coming. Right? But when it comes to secretion, the whole cell that dies, whole cell is disintegrated and that is released into the system. So they are coming in the layers, because it cannot happen just one layer it is destroyed, but then the whole organ will get destroyed. But new layers, they keep on coming from underneath and the whole cell, right, they are getting. Basal layer is mitotic. It has to, right? Basal layer has to be mitotic. Mitotic means similar type of cells, they will be produced again and again and again. And this is the sebaceous gland. So sebaceous gland, when these glands are blocked, when they are blocked, that leads to all those pimples. And this secretion would not be watery, that it would be a thick secretion, correct? Because it is that secretion which is keeping, and that's why they say that some skins are oily skins and some skins are, say, very dry skin, some are the medium type of skin. It all depends upon the sebaceous glands. If number of sebaceous glands, and the sebaceous gland, they are under the action of sex hormones. Right? So when the secretion increases, so and if the duct is blocked, so that is what will lead to acne, right, or the pimples. So that's a major difference between type of skins. So in holocrine, holo means whole. Whole cell is disintegrated, and its content, they go into the form of secretion, and the new cell is forming, right? New layers are forming one after the other. So these are the three types. So we learned first classification and the second classification. So first classification was based on the type of secretions, right? What secretion? So in which we say mucus, serous, and mixed. And then we said the mode of secretion. Correct. So acrine, apocrine, and the holocrine. So these are the two classifications. Now comes the third classification, which is based on the branching pattern. How do they branch? Till this point of time, we just understood that, we just took it like that, okay, there is one gland. Right? But that gland could really look like this. This classification scheme for exocrine glands, right? Exocrine glands. This is based on secretory and duct position. Now this makes sense because it will not be implemented on endocrine, because endocrine, so they don't have duct. Right? So this classification will not be good for them. This is good for only exocrine. Because this classification is telling that who is getting divided. Right? So it is based on secretory portion and the duct portion of gland. So whether we call them simple or compound. So here it is the first one. This is what is called as the simple tubular gland. Simple tubular, no rocket science. This is the duct. So एक simple duct and one simple secretory portion. Right? So this is what is called as the simple, but we added one term, tubular. The second one, this is simple branch tubular. Right? Duct though is there, but now the secretory portion, that is more, that is branched. So this is one duct, and 1 and 2 and 3. That's it. So this is a simple branch tubular. We'll see the example of all the types, right, along with the real images. So just understand. Then the third one is the simple coiled tubular. Simple tubular. Simple tubular. Simple tubular means there is only one duct, and then there is one secretory portion, but this one secretory portion is coiled, right? Here it is. It is coiled. So that's why we gave a new. Otherwise, we can say that this is nothing. Simple coiled tubular is like a subtype of simple tubular. And that way also you can remember, but just the difference. Now comes the third one. This is simple acinar. Right? Simple acinar. This is the secretory portion. This is the secretory portion over here. And this is simple branched acinar. So what was this acinar? These acinar, they will be now the mucus secretions. Let's take example and it will be still more clear. Here, let's start with simple tubular. Crypts of Liverpool, jejunum, right? See, these crypts of Liverpool, they are simple tubular, right? So their formation is just like this. All the cell types, right? They are like this, duct and the watery secretion. Simple branched, so that is what will occur in stomach, right? That is called as the fundic gland or the fundus of stomach, right? And the uterus. Speciality is whenever this branch thing occurs, so fundic are auxentic. Oxyntic means they are acidic and they secrete HCl. So when we say that stomach, in which there will be secretion of gastric acid, so those gastric acid are simply because of simple branched tubular. So glands are like that. The sweat glands, this is a real section. Right? So the sweat glands, they are actually like this coiled one. So these are sweat glands, simple coiled tubular. The next one, this is simple acinar, or these are the alveolar. They secrete oily compounds of tears. These are all oily. Right? So sebaceous glands. So these sebaceous glands, 30 to 40 variety oriented in the normal lid. Even in eyelid. See, they are called as the Meibomian gland. Right? These are called as the Meibomian gland and into the eye. So skin orbicularis oculi, these are the muscles around the eye. And then there are hair follicles, there is perifollicular glands, peri means surrounding the follicle, and these are the eyelashes. And behind it, there is a Meibomian gland. So at times, it happens that in this particular area, a swelling appears, which is due to these glands. And these are now branched ascia. Right? So here it is, the hair follicle, right? See the duct, and these are all the big ones, sebaceous glands, all the sebaceous glands. So these will be the areas which will be secreting heavily, and finally this oily secretion, it will go into the duct. So it will go into the duct. So that is a hair follicle. In this, there is no hair, otherwise here like this, with the base, it will look like this. That one will look like hair. But here, the hair has been missed. It has been removed. So this is the duct. And when this duct is obstructed, right, obviously, so this collection will continue, and that will lead to accumulation. Now, this is the classification scheme for exocrine glands. So, which is based on secretory and duct portion of glands, right? Simple or compound. So, till this point of time, we saw that it was all simple. In simple, it was like one duct. In compound, now see the number of ducts they have increased. So, now we have got the compound tubular, compound acinar, and compound tubulo-acinar. The difference, compound acinar and compound tubulo-acinar, the difference is this. When it is tubulo-acinar, right, see up to this level, right, the secretory portion is almost till the end, and then the ducts, they are joining. While over here, the secretory portion is only into this. Right? So over here, it is this duct and the secretory portion. Right? So this is the duct and this is the secretory portion. While in this compound tubulo-acinar, so duct is small and the secretory portion is pretty big. Ducts, they are coming up only at the last. Right? While over here, there is substantial duct which is seen. Right? So you will be able to watch the duct move. Now in compound tubular, in duodenum, they are called as the Brunner's gland. Now when we'll be studying the systemic histology, at that point, all these images, right, they will be seen even into the oil immersion, right, in 100x. So that's where we will be seeing the difference. But today, it is like you need to remember that yes, this is how the classification, especially how the glands they look like and where are they present. So one, the characteristic, and second, its location. Bus. So they are into the duodenum. Right? So see the stomach, right? And then that's the first part of duodenum. That's the first part of duodenum. Then comes the second, then the third, and the peritoneal fourth part. So we see this thing in duodenum, and they are called as the Brunner's gland. The name is Brunner's gland. Here we saw that in case of mammary glands, they were apocrine. So apocrine was a type of secretion. How do they secrete? But how will they really look like? That is how they will look like. Now see this in this particular section. These glands, they are these ducts, these secretory portions, they are in 3D. Right? So when a section is taken, sometimes section goes through this, sometimes section goes through this portion. So some of the glands, they are cut horizontally, some of the glands, they are cut vertically. So here it is. Let's see, this is how the secretion looks like. So here, pyramidal cells, right? Pyramidal cells. And see the duct, right? So that's how. And salivary glands and pancreas. Right? In pancreas, there are islet of Langerhans. So these are islet of Langerhans. That is what the beta cells, right? That is what secrete insulin. So they are compound tubuloacea. Compound tubuloacea. I mean, they will be secreting. So there will be the ducts. Will be the ducts, and then there will be the long secretory portions, right, which will be secreting the substance, and they will be going into the duct. So this completes our basic histology. We'll be starting systemic histology, I think, next time. So in just 2 more sessions, all these things, they will be deciphered even to the higher levels. You'll be knowing, but this much is asked in the histology of your first Mbbs. So if you know this much, right, histology is sufficient. Even from the perspective of USMLE. Because in USMLE, systemic histology and this basic, they both are asked. Right? So basic, you know, systemic, we'll discuss next time. So once that is complete, so it is done. Achha. A question which I wanted to ask was, those who are outside India, right? Those who are outside India, because I asked that thing and I told you to email also, but I haven't received much of the emails. Which subjects they are going on right now? Because I was told that anatomy has started and it will be over within, say, 3 or 4 months. So currently, what is going on? If it is anatomy, if anatomy has started, then which region? Okay, upper limb. One answer is upper. So hand is upper limb. So hand means they must have started with the chest. No? Right now, there's chemistry and medical biology. Anatomy will start in January. Okay. Okay. What else? थोड़ा fast answer दो. Answer bit quickly. Because if you will say so, then I can plan rest of the lectures in such a way so that it goes in sync with what you are studying. Okay, histology not started yet. No worries. What is doesn't matter for those whose university has started. What are the topics which are going on? Whether it is online or it is offline, whatever. Latin, Georgian, scientific research. Okay, upper limb. And there are 18 people, just 4 replies. तो दीपनीता अभी क्या चल रहा है? I mean, when you say that other subjects will start in January, so what is going on right now? It's a Latin word. What is the scientific research? Scientific research means okay, anatomy, biochemistry, genetics. Okay. Nirman, what you have written? Upper limb 1.5 hour में खत्म कर. Means upper limb is over in 1.5 hour. Is that what you are telling? 1.5 hour में तो brachial plexus भी खत्म ना हो. See, okay, I got it. They just leave the names in all there. ठीक है. See, upper limb is very important, especially the brachial plexus. So many questions, even in clinicals, even in USMLE, step 1, right? In step 1, so many questions will come from the brachial plexus. And those questions, they are like scoring questions. They are like mathematics. Say in step 1, you ask so many questions about the step 1 kaisa. Today I'm telling you that why they say that this is the most difficult exam on the planet. It is not difficult, but it is divided into 3 parts. Some questions, they would be the basic questions. They say कि अगर जो ये नहीं पता ना तो आप लायक ही नहीं हो ये एग्जाम देने के. So these are the questions which are about 40%. In these 40% questions, when I prepare, I say that you should score 100%. मतलब 40 में से 40, 39 भी नहीं, because we know that आगे जाके there'll be few diagnostic questions वहाँ पे कुछ problem होने वाली है. So these are the questions which you can't miss, right? You just can't miss. And brachial plexus is considered as this. Brachial plexus in and out with root value, this, that, how it is the formation, how the cords are formed, आगे क्या, पीछे क्या, everything you should be knowing it thoroughly. Period. और कोई argument नहीं. मतलब I am not commenting on this 1.5 hour, but no, कुछ नहीं. I'm just talking to as if I'm talking to you personally. ये brachial plexus you should know very well. And second thing which you should know very well is the hand. Right? Hand. Especially the flexor retinaculum and the extensor retinaculum compartments. Right? Because this wrist carpal tunnel syndrome, right? That you should know very well. So some of the questions, they are basic. Some of the questions, right? Almost another 35% of the questions, they'll be like, I would say they are easy. But easy if you really apply yourself and apply your knowledge. So then it is not that complicated. While rest of the questions, they are special. Special means they will not be coming out of the syllabus, but special means because they'll be having some trick questions. So unless and until you are clear with the subject, it becomes difficult. Everyone finds difficulty in this. Otherwise, So these are like holding about 25%. That's where things go wrong. So obviously, जब पता है कि यहाँ पे थोड़ी तकलीफ होने वाली है, तो in these areas, so we cannot take chance. So spend some time. Right? That's why on YouTube I have discussed that all upper limb in full detail. So go through all the things. You can just play it at a faster pace, but at least कुछ नहीं तो notes सब download कर लेना. All the PDFs are there, right? So download all the PDFs and go through those images. In anatomy, they have completed a head and neck, thorax, and upper limb. I mean, head and neck, thorax, and upper limb. It takes 6 months to complete this much. In how much time it has been completed? Head and neck, thorax, and upper limb. 9 weeks. That is 2 months. तो दोस्तों ठीक से पढ़ लो. I am not getting it. Thorax in one lecture, and each week we have one lecture of 1 hour. So in 1 hour, तो नहीं. खुशी, सोनल, निर्माण एंड रुचिता, आप चारों ने जो लिखा है ना, जस्ट मुझे इन डिटेल मेल भेजना ना, ठीक है? बिकॉज यू ओनली फोर एंड वैष्णवी एक्चुअली एवरी टॉपिक दे कंप्लीट इन वन लेक्चर. हाँ, मतलब टॉपिक तो ब्रेकियल प्लेक्सस भी व्हेन आई टेक तो आई फिनिश इन वन लेक्चर. ब्रेकियल प्लेक्सस इज वन टॉपिक. मसल्स ऑफ से rotator cuff muscle is one topic. So, but then there are 15 topics, 15 major topics in upper. ठीक है, आप मुझे डिटेल में मेल भेजो, because we need to, मतलब I don't want to discourage you, but जब आप यहाँ आओगे वापस इंडिया, and when you'll be facing this next exam, or if you are planning for USMLE, so this preparation is going to put you in trouble. हाँ, so ये preparation जो है ना, ये आपको तकलीफ में रखेगी. मतलब मैं कोई bias नहीं, कुछ नहीं. I don't want to speak bad about any university or any teacher, but simply I am concerned about your career. मतलब ऐसा नहीं होना चाहिए कि suddenly when you find in your final MBBS and then like everyone they say बस this is the question bank, इसका रट्टा मारो और खत्म. That should not happen. Because I've seen people failing 3 times, 4 times into those exams और फिर रोते हैं कि ये क्या किया. Right? Even this small number, right? This indicates what? मतलब यहाँ पे 18-19, मतलब 19 में तो मैं भी आ गया, right? So we are just 19 people. But at least what I feel is कि 18 लोग तो ऐसे हैं, those who are genuinely interested in studies. Otherwise, this number should have been more than 300. But कौन संडे को पढ़ता है? रुचिता, that will be the best thing. Curriculum picture, हाँ भेजो ना. I mean, उससे क्या होता है कि you guys remain in touch. मेल्स आती है पुराने स्टूडेंट्स की. इस बैच में से there are, I know on fingertips, I know by name ना, तो मुझे नाम से पता है, कुछ ही लोगों की उम्मीद है. But what is going on into your university, because accordingly I can plan my further lecture, because my plan was to start with GIT, because respiratory system, RS, CVS, GIT, And immediately after GI, they will take the neural system, nervous system. Right? And after nervous system, we take the endocrine. And you know, all these systems, these 5 systems, they are the killers. Beta, anatomy, I can start, but see, anatomy, you just go through the. Acha, chalo, let's do one thing. एक महीने में ना, one Saturday and Sunday, right, we'll keep anatomy. All the dissections and everything has been put on the YouTube. वहां पे आप देख लीजिए, जो भी प्रॉब्लम है, right, in one single mail. मतलब you just keep on writing कि जो problems है, and then send a mail. We'll keep one Saturday, Sunday for the anatomy. Combining, मतलब this is like I'm talking to you 18 people. बाकी का मुझे नहीं पता. Right? Whatever they are doing, all the best. They must be studying well. Right? Let's be selfish. Purely, it is like I'm talking to you. And accordingly, we'll take that anatomy. So we'll clear all the doubts on that day. So surely we'll do that. Yes, here. No. What happens is that when some, say, those questions which are sent, right, now their descriptions, they are so long, so it becomes very difficult to really type. But if it is to be solved, सबके साथ करना हो ना, तो then लिख के that becomes much easier. Because if I have to really type those things, it will take hours. And from next week, start physio in our. Kushi, apna mujhe sab all this is like I'm talking to all 18 of you. Just send me the details. Because picture should be clear even for me also कि आप क्या कर रहे हैं. And scientific research तो अभी भी मुझे समझ नहीं आया कि what exactly is this scientific research? Who wrote that scientific research? कहाँ था? Someone wrote the scientific research. Ruchita. What's that scientific research means क्या? The first year में क्या होता है scientific research? चलो, send me the mail. में लिखना, but because there is no subject like scientific research in any of the Indian colleges. मुझे नहीं पता. Sociology, professional development, medicine, arts. Okay, they ask you to make presentation in all subjects. All matlab? Wait. Don't get confused. This should be the pattern, right? First MBBS, second MBBS, third MBBS, right? These are the MBBS. That means these are the academic years, right? Year wise मत जानना 12 महीने का नहीं. मतलब यहाँ पे first year, second year, third year, right? So this would be of 12 months. This would be of 18 months, and this is of 24 months. Correct? These are the first MBBS, second MBBS, third MBBS, and these are the duration of it. So first MBBS mein, it is the anatomy, puri, full, physiology, and biochemistry. Right? These are the main subjects. It is about like human resources management, HR management, research quality. Pharmacology, right? Pharmac, patho, and this parasitology and microbiology, microparasito, and very interesting, forensic medicine. And over here, it is surgery, medicine, and gynec obstetrics. बाकी के सब सब्जेक्ट्स, बाकी के all subjects, right? That is the, say, pediatrics, then ortho, ENT, then ophthalmology, right? All those things. They उनके I mean एक महीने के साथ लेक्चर आते रहते हैं, रोटेशंस. And radiology is with all, right? It is associated with everything. So this is the pattern. This is how the medical studies should go on. Or by this method, when you'll study, so by the end, there won't be any trouble into any of the exam. So kuch bhi ho, will plan in this way only. First they've included biochemistry, ठीक है, biophysics चलेगा, histology is okay, cell biology चलो ठीक है, genetics, oh, it is a part of it. Georgian language, Latin, and IT. IT is information technology. Imaging is information technology. So do they teach the IPv6, IPv4, all those? Networking and everything? Or they are teaching you AI, artificial intelligence, and the machine language and the deep machine language? We send a mail. Consider this thing as the foundation. Okay. So consider this thing as foundation. This is how, because see, you have got fixed time, right? 5, 5.5, 6 साल में सब खत्म करना है. And at that point, you'll be under stiff competition with everyone in the world, right? Irrespective of in which country you are. This is the thing. These are the things which you have to learn. So plan ahead. This is just the beginning. मतलब अगर जो अपर लिम 1.5 घंटे में खत्म हो रहा है, right? So it is a serious matter. It is a serious matter. ठीक है निर्माण, देखो, सोशियोलॉजी एंड प्रोफेशनल डेवलपमेंट वो सब आ जाता है, राइट? एग्जाम होगी तो ठीक है. I would मतलब very bluntly say, right, even though this thing might be getting recorded, but I'm telling bluntly that sociology and professional development वगैरह, if you are a bit smart enough ना तो ऐसे निकल जाएंगे subjects if they are taking exam for it. Because in Indian colleges there are no subjects like this. क्या professional development? If you know your subject, automatically you will be professional. And professional development is what, when it comes to medicine, so in that there would be, मतलब आपको लगेगा, but there would be 4 lectures, मतलब 2 घंटे के 4 lectures in which I'll drill you just how to take the histology, क्या history, how to take the history, patient से बात कैसे करनी है. That is what is one of the major criteria in step 3, even in step 2, how to deal with the patient, how to talk with the patient. Matlab, you cannot talk unnecessary things, because if behind every question you are trying to decipher something, that is what is called as the art of differential diagnosis. Abhi se wo sab karne ke liye, matlab kya, when it goes by topic to topic, साथ साथ as I keep on telling you, वो खुद आ जाता है. उसके लिए कोई अलग से सब्जेक्ट की कोई जरूरत नहीं है. 2 books for professional development that we have to read. खुशी भेजना ना, अगर जो e-books हो तो I would like to see those books. If in case if they are e-books, so kindly send it. Are they e-books or physical books? Medicine and arts. E-books हाँ तो खुशी भेजो, right? Just send it. भेजना आज ही भेज देना. And Nirman, what is this medicine and arts? If there is a book, then please send. Right? Just send it to me. See, I find that I usually keep a note of this. कि कौन-कौन है. So I've seen that you guys, you are always present, irrespective of मतलब कुछ भी हो, lecture late हो, आगे हो, पीछे हो, लंबा चला lecture, but you guys are always there. So if you are that sincere, so it becomes my duty. We have to see paintings of disease and we should. Paintings of disease? Artistic picture of all diseases? Really? मैंने तो कभी देखी नहीं ऐसा. I never seen things. वो तो जोक्स के लिए अलग बात है. मतलब पुराने जमाने में मतलब जब मतलब we used to do those things into our those stage show करते थे तब वो आरी लेके ऑर्थोपेडिक सर्जन तो मतलब वो आरी लेके आ रहा है और सर्जरी वो सब मजाक की बात अलग. पर इस पे डिस्कशन क्या? Why to waste time यार? कम कोर्स है. I mean डरा नहीं रहा बट मतलब सीरियसली भगवान के साथ फार्मेक एंड पैथो मतलब बैंड बजा दें. If you don't learn anatomy and physio proper ना रो पढ़ते हैं लोग फार्मेक और पैथो. सीरियसली. Forensic medicine तो मतलब it is super interesting. मतलब you know about guns, छुरे, ये वो murders, right? All suicides, toxins, various types of poisons, fire, सब. Just send me the course curriculum. आप में से मतलब जो भी हो आप just भेजना. I just want to see whether these subjects they are part and parcel of it. Being a doctor, you can be called in the court. We give your judgment. If you are in गवर्नमेंट हॉस्पिटल तो जाते हैं डॉक्टर्स. हम लोग भी जाते थे कोर्ट में. What is your impression for this particular case, especially when it is accident or it is some murder? Okay, so say remain in touch. Even मैं आंसर ना करूँ ना करूँ तो भी remain in touch. I'll always try to answer. और कई बार क्या है मैंने मतलब कितने emails का एक साथ अभी बात कर ली. So it happens, but do remain in touch. Akushi, you raised your hand. Want to talk? Should I unmute you? I'm unmuting you.
Yes, so in our university, we have one subject as core body, and in that we have imaging, anatomy, and physiology, three of them as one subject.
Okay.
And one subject we have as biomedicine, and in that we have four subjects: embryology, histology, and genetics, and biochemistry, and cell biology. Everything in just one subject. So it gets very difficult during, like even during our midterms and the quiz we had, it got really difficult to do it all together.
Okay. So see, as I understand, I would say something like this. So when it comes to embryo, so as such, it would start with genetics. This is how we learn. It would start with genetics, and then you learn the embryology. Right? In embryo, one is the general embryology, and then comes the systemic embryology. Systemic embryology, that is when we learn the organ development one by one. Correct? When in general, all the way right from the conception to trilaminar disc till implantation. Bus. that entire process. Right? The 3 layers are generated, trilaminar disc, and then the folding, and then the development of the heart, the development of brain, the development of GIT, all those things, they go hand in hand. So this is like a continuous process. The basic genetics which you have learned till this point of time, right? Mitosis, meiosis, and what really happens, right? All those gametogenesis. So that is included over here. But then if you go about that, what happens in the Duchenne complex, Duchenne syndrome, so that thing goes separately. That it goes by as you are discussing the connective tissue, so then you are talking about the Duchenne. But अगर जो यहाँ पे आपने पूरी लिस्ट बनानी शुरू कर दी, तो then you go crazy. This is a continuous process. Even in medicine, you will come across the genetics in medicine in the final year. But because you are learning those areas, those subjects in so much of depth, that is when it is needed. So combining all of them into one subject, take it like this: genetics pada, embryology pada, but are they going into this sequence, or it is no? This sequence is not maintained. Okay. Evaluation has been completed and 4 to be completed. Okay. ठीक है. So let me say this. No sequence. See, this is the thing. In genetics, they have taught disorders. Disorders, they should come when you are learning that particular topic individually. कोई बात नहीं. Send a mail, right? Try to send the mail today. So today evening after 6 o'clock, I'll sit and I'll go through all the emails, right? And we'll design something so that it is useful to all of you. ठीक है? We'll definitely plan something. I'm not telling this pandemic, etc. That is not important, but अभी से उसके लिए this is जो कहते हैं ना मैनेजमेंट में कहते हैं कि there are few things which you must do. If you want to plan your life or you plan your studies, some of the topics or some of the things in your life which you must do. There are some things which are like maybe. And third group is it is at ease. Because at ease is the easiest thing. People try to do this thing first. Right? So no, we'll redefine this entire thing. Must do will always be taken first, even if they are difficult. Maybe that would be the second. And at ease, those topics, none of the subject is faltu, right? But those things which are not very important for your future or into the step 1 or into the next exam, I never encourage that thing, but in subjects के लिए थोड़ा बहुत रट्टा मार के just remember, मुझे e-books भेज देना ना. So I'll figure out the keywords from it, what questions can be expected from it. So उसमें से उतना करके जाने दो. Our main intention is to save your time, and these are the areas where we should really focus. So what should we send? List of subjects and what is the curriculum? आपने भेज दिया कि upper limb, lower limb, or if you don't write कि ये 1.5 घंटे में खत्म किया, तो I would never ever know. Because मुझे पता है, it takes 1 full year. पैक फुल ईयर, यहां से लेके यहां तक 1 साल लगता था. और लास्ट में तो ब्रेन में सर 4 घंटे के लेक्चर एंड 4 hours इट इज लाइक मॉर्निंग 9 बजे लेक्चर शुरू हुआ, 1 बजे खत्म. एंड दिस से कि 1 to 2 was the recess. सर वुड से 1:30 बजे आ जाना, 1:30 एंड 1:30 से ऑल द वे टिल 5 o'clock. 5 बजे के बाद ओके बस 5 का 6 भी बजे, इन दैट वे 4 दिन में ब्रेन खत्म होता था, बिकॉज इट इज सो फैंटास्टिक. मतलब 220 स्टूडेंट थे हम, बट प्रेजेंस यू विल फाइंड के 216 218 लोग, एक या दो, 1.5 घंटा भी शायद ज्यादा बोली. नहीं दोस्त, निर्माण, बड़ा फ्रैंकली ईमेल लिखना. निर्माण क्या, आई एम टेलिंग टू एवरीवन, जस्ट ओपन योर हार्ट. मतलब जो लिखना है सब लिख देना, वी शुड रियली नो, क्योंकि बहुत ब्लंट लैंग्वेज में बोल रहा हूँ. इफ एनीथिंग गोज रॉन्ग ना, एट द एंड ऑफ द एमबीबीएस, और जब रोने बैठोगे ना, नो वन विल कम टू, आंसू पूछने कोई नहीं आएगा. एंड व्हाट वुड हैपन इज दैट यू आर हियर, इफ यू आर नॉट सक्सेसफुल तो देन द पेरेंट्स का प्रेशर, कह रहे इतने लाख खर्चे, राइट. देन योर कलीग्स, जो आपका सर्कल है, कह रहे डॉक्टर बनेगा, डॉक्टर बनेगी, अब ये क्या कर रहा है, राइट. एंड देन योर पर्सनल स्ट्रेस, एंड देन व्हेन द फ्यूचर, वो जब लगता है कभी, और व्हाट वुड हैपन, दिस इज वेयर द डिप्रेशन स्टार्ट्स. अभी से, राइट फ्रॉम द बिगिनिंग वी प्लान दिस, बिकॉज जो स्टूडेंट्स कुछ है, मतलब अगर जो मैं उनके ईमेल दिखाऊं ना, आप लोग रो पड़ोगे. 3 बार फेल हुए हैं, एंड दे आर लाइक ऑन द वर्ज ऑफ, कहते बस नहीं जीना. उनसे फोन पे बात करनी पड़ती, उनको फोन नंबर दिए हुए. रात को 2 बजे, yesterday one student called up at 2 o'clock in the night, कहते सर 2 मिनट बात कर लीजिए. का कोई बात नहीं, बोलो. सो नहीं, आई डोंट वांट टॉन्ट अस इन ओरल्स. टॉन्ट क्यों मारने का, नहीं. कभी भी ऐसा लगे, इफ यू डोंट, इफ मेरी कहीं पे गलती हो, मतलब आप में से किसी ने, एक ने मेल किया था कि सर आपने सीधा बोल दिया माय मिस्टेक. हाँ यार, इट वाज माय मिस्टेक. मैंने पहले गलती से बोल दिया कि बेजल लेयर के हिसाब से वो नाम आता है. नो, इट वाज माय मिस्टेक, जो टॉप लेयर के हिसाब से आता है, और वो हो गया गलती. तो व्हाट्स द व्हाट्स द प्रॉब्लम, मेरे से कभी गलती होगी तो डेफिनेटली यार, यू कैन ऑलवेज, एंड हुई भी है. मतलब मैंने तो यूट्यूब वीडियो में मैंने 2-3 बार मिस्टेक की है. एंड व्हेन सम स्टूडेंट से कि सर ये बोला था, कहा अरे यार सॉरी, ऐसा नहीं, ऐसा. Started with vertebral column, then head and then neck, then back, then thoracic wall, then upper. ये क्या ऑर्डर हुआ? गुस्सा करते हैं? कौन गुस्सा करते हैं? टीचर? अरे आराम से मेल लिखो, सब सब, निर्माण, सोनल, खुशी, सब सब सब. सो लेट मी बी क्लियर, 50 to 60 पेजेस का आपको मटेरियल दिया पर वीक. हाँ ठीक है, बट इज दिस मटेरियल, मतलब जो आपको पढ़ा, they teach this material and then they give it to you, right, for the assessment. Okay. ठीक है, send me the mail in detail. They don't teach detail. They don't teach in detail and they ask in details. If that is the thing, so then it is wrong. Then it is. Oh, then it is. कोई बात नहीं, चलो जो हो, right? Send a mail to me. Okay. Bindas लिखना. Bindas. What I mean to say bindas means absolutely bindas. And we'll plan something. जरूर कुछ करते. Because see, we can't change the system, but we can at least design our life. बस. ठीक है? हाँ, how to make notes. अच्छा किया यार. This is for the medical science. Right? In fact, this is for any of the subject, but medical science के लिए follow this practice. Some notes, they are like pre-prepared notes. Say for example, the PDFs which you get, right, जो मैं आपको देता हूँ, so these PDFs, they are ready PDF. एक बार PDF देख ले, right? Then you go through the video, run the video at double the pace, double speed, and just see कि yes, everything is clear. Once it is clear, ये video अब दूसरी बार देखने की जरूरत नहीं. This PDF you need to revise. So how to revise? The revision pattern. If you don't follow this revision pattern, the trouble is आगे आगे जैसे पढ़ते जाएंगे पुराना भूलते जाएंगे. In medical science, in engineering, things are different. That in every semester, whatever it is asked. But in next semester, they are the new subjects. Previous things they are not asked. Not over here. In surgery exam, you can be asked what are the structures which are found in the bed of the stomach. Stomach के पीछे कौन-कौन से structures है, list them. Yes, that can be asked. That can be asked even in Viva. So we are supposed to know everything right from the first till last. So that's why this revision pattern, that is vital. For this revision pattern, remember the rule of 3. Right? First, day 0. Day 0 means you have learned any subject today. आज कुछ पढ़े. Before night, when you go to sleep, before sleep, just go through that subject. No need to go line by line, word by word. इसकी जरूरत नहीं. But just go through that. Just flip through those pages. That way, right? Fast. 5 minutes में वो subject आपने. Just it should pass under your eyes before sleep. This is day 1. That is the next day. As soon as you wake up, right? As you wake up, once again, एक बार देख. In both these cases, no more than 5 minutes, but it should be scanned by your eyes at a high pace. Then comes within 3 days, again, same. So see, this thing, it requires one diary. कि आज ये सब्जेक्ट इसी में लिख लिया कि these are the glands जो है आज देख लिया 3 दिन के बाद, and then comes 1 week, 3 week, 3 months. 1 week, 3 weeks, 3 months. And for these, select any of the Sundays. जो भी Sunday आ रहे हो, क्या on Sunday, this Sunday, I'll sit and I'll spend 1 hour. And in that 1 hour, you are just scrolling through those pages, those topics at a high pace. Your brain is so powerful because if you follow this pattern, all your memory, all your knowledge that is laid into the form of protein chains. By revising this format, you are replenishing those protein chains. Right? Those protein bonds, they become stronger and stronger. Because from next, they will straight away 3 years. For 3 years, you won't forget. Right? So if you don't follow this pattern, then subject becomes difficult. This requires discipline. If you follow this discipline, you will find that as you progress now, things will be so effortless because you are knowing that आज मुझे किस चीज का revision करना है. And when you know that yes, today I'm supposed to spend 2 hours for revision, automatically this becomes your target. that मुझे 2 घंटे चाहिए. I can't waste कि ये पार्टी में गए और ये आज तो मूड नहीं है. No, there is nothing like mood, because you are now into the military mode. There is nothing like mood. अपने पे कभी दया मत करना in next 5 years. बिल्कुल दया मत करना. Right? Have a cup of coffee. ऐसा हो तो black coffee and bad job. Right? No excuses, because the end result is like when you'll be so successful, right? And when people would say, "Kare, Dr. Nirman, Dr. Sunal, Dr. Heer, Dr. Pooja, right? Dr. Deepnita, the baki ke sab bhi, all included, right? You'll feel so good. You'll feel so good. So remember that. Remember that day, right? Keep that. It is what is called as the vision board. It is called as the vision board. और बिल्कुल बेशरम हो के एक इमेज बनाना, बिंदास. वहां पे डॉक्टर, write your name, write everything you want to be after completion of your MBBS, you want to be MD, you want to be, so be super specialty. Bindas. Make this. This is what is called as the vision board. It keeps on reminding you कि बस मुझे क्या बनना है, so that मैं आलतू फालतू में time waste ना करूं. This is what is called as, it is actually called as vision board. Right? किसी को मत दिखाना, because people लोग हंसते हैं. Right? This is my experience. लोग हंसते हैं कि ये क्या किया है. And still today also, right? I make every year I make this vision board. Say Tata Mumbai race, if it is to run, say बिल्कुल बिंदास फर्स्ट क्लास तैयार. Right? In that diary yesterday, I'll share that small video. Right? I'll put it into our shared folder. In 1 hour, 32 minutes, 67.74 kilometers of cycling. I was drained. हालत खराब हो गई. But this is इसका फिर वीडियो लिया. As I was completing, so this is because it is necessary to build up the endurance. So it was added into the vision board. So keep on adding into that vision board. I just added, yeah, cycling the next target 100 kilometers. So these vision boards, they are the most scientific things, because it keeps on telling your brain कि बेटा line पे पढ़ो, right? Or work, whatever, right? So that they don't allow you to deviate. There is a very subtle difference between those who are successful and those who are almost successful. वो कहते करे यार मैंने जरा सी मेहनत की होती तो मेरा ये हो जाता वो हो जाता. नहीं, कुछ नहीं. One who was successful, he was knowing beforehand, so that's why he was moving exactly on the path. And time is something which is so easily available, so that we endlessly waste it. अभी भी इतना भाषण दिया, but just tell me, आज के दिन में have you wasted 1 hour सुबह से लेके अब तक अपना लेक्चर शुरू हुआ उससे पहले एक घंटा वेस्ट हुआ कहीं पे भी? You feel like कि वो फोन पे unnecessary बातें की, या मैं बैठी रही या बैठा रहा, कुछ नहीं किया. मतलब you feel like यार I could have used this hour creatively. Nirman, Apurva, see, you guys are so honest, right? So पूरे दिन में imagine if you are just, you can say 1 hour, ज़्यादा नहीं, 1 hour. In 1 year it becomes 365 hours, productive hours. कहाँ गया? मतलब when it comes to 5 years, it comes to about 2000 hours. और कई बार तो अपने 1 घंटा लिख रहे हैं. We waste even full day, है ना? पार्टी थी, ये था, वो था ना, all those. नहीं? Because when you'll be successful, तो तब then everyone would appreciate कि हाँ वैष्णवी जो है ना, मतलब वो तो पहले से she was different. वो पार्टी वार्टी में नहीं आती थी, right? Very studious. Then suddenly you will be like a god for everyone. When they'll say, "Kare, Dr. Nirman जरा आप आएंगे, मेरी डैडी की तबीयत ठीक नहीं है," and then you diagnose, then you give treatment, उनको अच्छा हो गया, तो देन पीपल वुड फील लाइक, मतलब आपके साथ सेल्फी लेके, अरे मैं इनको जानता हूँ, डॉक्टर निर्माण को जानता हूँ, मैं डॉक्टर हीर को जानता हूँ, राइट? दैट इज व्हाट विल हैपन। अभी जो लोग हंस रहे हैं हंस रहे हैं, दिल से कह रहे हैं ये सब करने की कोई जरूरत नहीं, नो, जरूरत है। So and actually this thing will happen when you will be big shots into the medical science. देखना क्या होता है, आपके नाम बदल जाएंगे। मतलब जैसे अभी प्रथमेश, तो आपको किसी भी नाम से बुला देंगे, प्रथु इधर आ, राइट? एंड देन सडनली, अरे डॉक्टर प्रथमेश भाई आप बात में ये काम, मतलब सडनली द एंटायर थिंग वुड चेंज। वो आगे पीछे वो भाई और ये साहब और वो सब लग जाए, एंड देन पीपल वुड फील, मतलब क्रेडिट लेंगे, अरे मैं डॉक्टर तेजस रानुष को जानता हूँ। दिस इज व्हाट हैपेंस। नो वन नोज कि इन मेकिंग अप ऑफ दैट फाइनल प्रोडक्ट वो कितनी तकलीफ पड़ी थी तेजस को। नो, नो वन नोज दैट। पीपल ऑलवेज वॉच द फिनिश प्रोडक्ट। सो all of you just write something, because it gives, I make one diary, I got one diary, अब तक उसमें almost 1600 students, more than 1600 students का सब डिटेल मैंने डाला, and I know that some of them they are very severely depressed or कुछ भी है, but it is my responsibility to support. So see, this is what I marked. We finished the lecture about सब्जेक्ट तो 45 मिनट पहले खत्म हो गया था, पर 19 में से एक भी चना कम नहीं हुआ। ऑल ऑफ यू आर प्रेजेंट, अदरवाइज तो सब ड्रॉप होना शुरू हो जाते। सो दैट्स वेयर आई सी योर डेडिकेशन। कोई बात नहीं निर्मल, नो वरीज। विजन बोर्ड बनाया वही बड़ी बात है, इसमें से कुछ मिस हुआ, नो वरीज, बट डेफिनेटली नहीं बनाया होता तो कुछ भी नहीं होता। बनाया है तो एटलीस्ट मैं तो बोलूं 10 में से 5 चीज कंप्लीट हुई, चलेगा। इफ देयर इज नो टारगेट, लाइक अ फाइटर पायलट, इफ देयर इज नो टारगेट तो प्लेन उड़ा के वापस आ गए। इफ देयर आर 3 टारगेट्स तो इवन 2 को हिट किया तो भी अचीव समथिंग, नो वरीज, ठीक है? सो ठीक है, it's not exactly same but similar, no worries, no worries. All right, so thanks a lot, thank you so much. हाँ, ये जो ईमेल एड्रेस मतलब टिल यू आर एमबीबीएस आई क्रिएटेड विद जेन्युइन हार्ट के नहीं, बट आई फील बैड व्हेन पीपल गेट डेविएटेड, नहीं मजा आता। So take care and see you soon.